Advent Basic Life Support, brought to you by Gintervins Healthcare Foundation, Monitor Healthcare Limited, Victory Drugs, and Encapsulate Healthcare Solutions. We definitely hope that this will be an impactful time and that this information that will be shared today may help you save somebody's life. So do pay attention. Do invite other people who you think would benefit from this training. I will go straight into it. I'll introduce the founder of Gintervins Healthcare Foundation, Dr. Andrew Agung, and we will share his welcome message. Okay.
Good afternoon, ladies and gentlemen. On behalf of the Board of Trustees of Gintervins Health Foundation, I welcome you to this, which is the fifth in the series of health education and public education webinars that we've had for professionals and members of the public. As they say, health is wealth, and an informed and educated public and professional is empowered. Today, we're talking about basic life support. And that's if you see an unconscious patient or somebody's having a heart attack or choking, you know what to do. If you're a healthcare professional, it is a good way to update your skills. And if you're a lay member of the public, it is a way to have an idea of what you should do. It might just save the person's life. We have a very distinguished speaker today, Dr. Femi Oguremi, who is doing a lot of teaching of this in Nigeria at the moment. He used to be based in the UK. We hope you will stay all through for the meeting, and there will be ample time to ask questions on any aspects of the talk or any questions you will have. I will now hand you back to our able moderator, Mrs. Flora Coker. Thanks for joining us. And as usual, we're always open for donations. We need donations to continue to put things like this together and to do the job that we do. We've only just sent 4 podiatrists to Lagos to look after the feet of diabetics, and we're able to look after at least 44 patients that would not have had that care. Thank you for joining and continue to support us. And on behalf of our Board of Trustees and our ardent and persistent supporters and facilitators, welcome and do have a good meeting.
Thank you very much.
Good afternoon.
Okay. Welcome once again to everyone who's just joined us. This is the webinar on basic life support. I will go straight ahead right now to introduce our trainer for today. Not just a speaker, he's training us today. Our trainer for today is Dr. Femi Oguremi. He's a medical educator and an appraiser in the UK. His background is in general practice, emergency, and tropical medicine. He's a keen teacher and teaches in various capacities, including his teaching activities around basic life support, which he'll be doing today. He also teaches immediate life support, which is certified by the European Resuscitation Council around Africa countries. He's the founder and CEO of Monitor Healthcare Limited, Area Doc Nigeria Limited, and Healthy Air Technology Nigeria Limited. He has a diploma in executive leadership for healthcare professionals from Cornell University. Dr. Oguremi has won many local and international awards. He's a fellow of various professional and academic bodies, including the Higher Education Academy in the UK. Dr. Oguremi, over to you.
Thank you so much. I hope you can hear me loud and clear. All right. Okay, brilliant.
Yes.
So, yeah, thank you so much. And it's a pleasure for me to be here today. And just like Flora has said, we're going to go through basic life support. Let me try and share my slides. Okay. Can you see my slide?
Yes.
All right, brilliant. So basic life support is what I'm going to teach today, and I'm not going to waste your time, but I can assure you that during this next maybe 40 minutes, 1 hour, we have a lot to do together in learning. At the end of the presentation, so I would expect us to be able to identify a situation where somebody is collapsed, and that's in cardiopulmonary arrest. We'll be able to initiate and deliver effective, cardiopulmonary resuscitation, and be able to identify when an individual is choked and how to support a choking person. And I will also go quickly talk around, how to put someone in a recovery position. One area that I've sort of lumped in here is an unconscious patient. We'll learn a bit around when somebody is said to be unconscious as well. All right. Now, basic life support training is one that I do, here in Nigeria, as has been mentioned. So I do train a lot of people. We've trained quite a large number of both lay people and professionals. What I'm going to teach you today is very rudimentary and very basic. However, the full, training comes under European Resuscitation Council curriculum. I'm going to poke out of it, even though I train for European Resuscitation Council. This is my personal slide, so it's not the slide for the council, right? I also have a partner in the UK, and the name of the company in Nigeria is Monitor Healthcare. So our partner in the UK is the Emergency Response Training Solution. So we do train the same, we do the same training in the UK as well. So, right. Now, I always like to start my training by, reflecting the name of the, the name or the title of the training itself. We say basic life support. So if we talk about basic life support, it means that there is a life somewhere. And I like to always ask, what do we mean by life when we talk about, life? Sorry, I know there are doctors or healthcare practitioners on this call, on this platform. I want to go, because we have mixed, what do I call it? Mixed delegates, I'll say, here today. I'm going to go sometimes quite low, and sometimes I go a little bit high, so that we can all benefit from this training. So to define life, unfortunately, this is a virtual training, so I can't see individual. I could have asked someone to define it for me, but let me go ahead and define it myself. For those of us that done biology in those days, we'll remember what we call Mr. Niger D. There is a mnemonic where we talk about the characteristics of living things. So those are the things that makes, life really. If you're able to move, you're able to reproduce, you're able to eat nutrition, you're able to feel irritability, you're able to grow, you're able to, excrete, you're able to, breathe, respiration. And then we then talk about the end of it, which should be anything that is living should be able to die. So anything that, exhibits those characteristics is said to be living. And I know the common thing that people always tell me in my training is they will say, if you're living means that you can, you can actually breathe and your heart is pumping. So I always want to introduce those organs involved in those two functions to us. So in fact, I'll make it 3. I'll also introduce us to our brain. So we have the heart. Let me just for those of us who are not medical, let me go back to that picture. All right. Okay, let me pick this. So arrow pen. Okay, let's pick the pen. Okay, so laser. Let's pick this. So if you see my slide here, this is the heart. okay, which has 2 chambers. And then we all have 2 lungs. Now, there is a group of doctors and nurses that are called, the gynecologists, and we talk about the midwife as well. These 2 people, sometimes I call them, this is just a joke though, I always say they're the wicked doctor and nurses. And then I know you want to ask me why. When a child is in the mother's womb, they live in water. They literally live in water, drink water, they float around, and they're happy. There's nothing bothering them. They tap from mother like a parasite. They really suck from mother. And then when the child is 9 months, what we tend to do, the gynecologist and the midwife, the wicked ones, in quotes, they will force this child to come out, okay? And say, wait, time up, you need to come out. So we bring the child out, and then as soon as we bring the child out of the mother's womb, then the struggle starts. And what is this struggle? All those characteristics that I said, when they were inside the mother, they don't bother too much about it. But now that they come out of the mother, they have to find a way of engaging with this. And how do we do that? You start breathing. A child that is inside the mother, that is inside a bag of water, you will wonder, how do they breathe? So they don't breathe in there. But by the time they come out, we sort of clip, the cord and separate them. Then the time starts ticking. The child's lung has to function. And the reason why that is for a child to be able to survive, they need what we call oxygen. The oxygen is plenty in the air, and it has to get to the cells. So the process of this coming from the atmosphere into the into the child's lung, and then from the lung into the blood system, and to be taken to the cells where the oxygen is used to break down the food that we eat to produce energy. It follows a kind of cascade, which is called the cardiopulmonary system. So the cardiopulmonary system is a system that links the lungs to the heart, and that lung also to the atmosphere to get the oxygen. So you take the child, comes out, they cry. The reason why the child will cry, there are quite a number of reasons, but one is they just find themselves in an environment they've not found themselves before. And then they have to take the first breath. All these things are just strange. And when they take the first breath, the lung is filled with air now. And then they push out whatever fluid is in their lungs. And that's why we suction their nose. And then during that period, oxygen is also taken into the lungs. And then this oxygen gets into the lungs. So you have a large concentration of the oxygen. Let me see if I have, right. So you have a large concentration of the oxygen. So let me just put it there. So this is the oxygen, let's put it oxygen that way. So it gets into the lung here, then a large amount of it in the cavity of the lungs. And then there's something we call diffusion. So when you have high concentration of gas somewhere, it sort of moves to places where you have low concentration. Like if somebody flick the perfume one side of the room, before you know it, you smell it on the other side. It goes by diffusion. So they diffuse into the base of the lungs, basically. And at the base of the lung, there's a high concentration of carbon dioxide. So this carbon dioxide also diffuses out, and the child will just exhale, pushing out carbon dioxide, taking in oxygen. Push out carbon dioxide, taking oxygen. And this oxygen is very, very important, like I said. You eat. That's why if you are living, you must be able to have that function of nutrition. So you eat. Some of us will eat apple, some will eat amala, some will eat rice and all these things. It will not get to your body like that. Your body will not use it that way. So your body will only use it when it's broken down into the unit that is able to absorb, like you talk about the nutrients, the glucose, carbohydrates, protein, minerals and all that. So it breaks down. And when it gets there, this nutrient has to be broken down further to then give what they call the ATP. ATPs, which are the bundle of energy that we burn and then we bounce around with. So this whole process is called the cardiopulmonary system, and it's very important. I take time to explain this because unless you understand that system, that, you know, oxygen is absolutely necessary at the cellular level, then it's difficult for us to actually understand why we feel resuscitation is important. So this, or everything I've discussed so far, is talking about life, a living thing. You understand? These are the things that you need to be living. Now, once this process is functioning, all is good. So a child is born, heart is pumping, lung is working. So the oxygen that is at the base needs to move. And for it to move, the heart needs to keep pumping. So it's more like a pump that then keep pushing the fluid, the blood around, so that oxygen then moves down to get to the cell. Then carbon dioxide is taken back, and then we exhale it. So that system, the cardiopulmonary system, is a perfect system that makes life happen. Now, I sometimes talk to my trainees and I said, once they come into my training center, I want to make them a mechanic. And people say, oh, I don't want to be a mechanic. Then the reason why I talk about mechanic is this whole process, you can actually liken it to what happens in mechanical objects. Let's talk about a car or a machine, a motorbike. Once there's fuel and there's oil, the car functions. So the oil is the energy that is going to be broken down, and whatever carburetor injector, whatever they use, they talk about, is the thing that rolls and moves things around. Now, if you are in a car and you're going somewhere and your car just suddenly make a foreign noise and then move again, lose power and stop, there's trouble. So that car, once it stops, then you need to get somebody to actually help you to jumpstart it to function again, either by way of, in those days when we used to use a manual car, you say you push it, like put in gear 2 and push it, and then jumpstart and the car pushes and move. Days of injector, now you have to get your machine and put the kit and look at where is the problem, and then you want to go and fix it. So we need to fix it. So when a car gets into a problem like that, then you then talk about a failure in the system, when the function of the engine pushing oil, pushing fuel in working again, then the car will stop. The same thing happens in human being. When it happens in a machine, then we look for a group of people called the mechanics, right? So you call the mechanics to come and help in jump-starting or fixing it. When it's human, you don't talk about mechanics. You today will become the mechanic that will mechanically, jumpstart human and make them functional again. Now, the only difference is when you talk about a machine or mechanical objects, you can play with time. You can play with time. You leave it and say, okay, I'll park this car by the roadside. I'll come back tomorrow. And then once I get a mechanic. But in human, your brain is what's very important. It's called the master clock. You're able to do most of this function that we'll talk about once your brain is functional. Now, the brain cannot be starved of oxygen more than 5 minutes. So time is of the essence. Once there is a system failure in human, you cannot wait. In fact, the earlier, the better. Once you start living, the longer you live it, if I would say time is life, because the longer you live it, the more the damage in the brain. And that's once somebody gets into a place where they're brain dead, that's what the doctors then say, this person is certified dead. That's what we look into people's pupil. You see doctor carrying somebody collapse, let's check whether he's alive or whatever. They put lights inside the eye. We're checking for the function of the brain. If the brain is dead and the pupils are dilated and fixed, there's nothing anybody, it's only a miracle that is left. So if we look at research, in all honesty, about 60% of the people that are dead now probably will be alive if all of us understand this training that you're going to learn, or this thing that we're learning today. If you know how to quickly jumpstart, we said within 1 to 2 minutes, if you're able to jumpstart somebody who is collapsed, then 60% of the time they will be alive. So it is a huge thing for us, right? So that is cardiopulmonary, cardiopulmonary system. Now, when this function is working well, life is on. Now, let's look at a situation where something happens, and then there is a failure. There is a failure. The failure can be as a result of so many things. And then the person goes into cardiac arrest. And then an arrest means that the heart isn't functioning again. This heart that has been pumping, stops. And once it stops, the system is abbreviated. So there's no continuity in that system again. And that's a major issue because, like I said, that thing that will take oxygen to the brain has just stopped. So there's stasis. Everything just stops. And then we talk about an arrest that just happened. So the cardiopulmonary system that was functional before, at this point in time, is arrested. So we talk about cardiopulmonary arrest, right? Which means that that function is gone. Now, the commonest cause of cardiopulmonary arrest is usually a problem in the heart, right? So somebody has, let me just make it easy. Somebody has maybe heart attack. And then we say, what is heart attack? An heart attack is an attack on the heart. The heart has vessels that, supplies it. Like the vessels would be things like the artery and the veins, but they have the artery that supplies the 3 major arteries that supplies the heart. Now, for any reason, that artery can malfunction a lot of the time, and this is why I will sort of talk a little bit to the public, and I know even my colleagues, because a lot of us we keep taking care of people, and then we ignore ourselves. I was in a program yesterday, and I was speaking to one senior doctor, a consultant, and then we sort of ignore ourselves. When we say just check your blood pressure, we keep going. Especially those of us who are medical, personnel. Sometimes we just think like we're iron. We just keep going all the time, helping people. You don't take care of yourself. You are not immune. So we need to check our blood pressure. Ordinarily checking your blood pressure. A lot of people are going around with, terrible blood pressure, very scary, So if we do not check our blood pressure, persistent high blood pressure will cause problem for our heart. There are other things. I'm not going to go into details about that, but that's a training for another day. There are things that would then lead to a place where the heart that has a blood vessel that is open, it could be as a result of what we eat or because of our weight, we have a lot of fat, then it blocks the supply to the blood supply to the heart, and then the heart then struggles. When you want to run, you run a little bit, you feel pain because the heart is not getting enough oxygen because of the narrowness of the blood vessels, and then that leads to what we call angina. We can talk about other things, but there's an angina, which are 2 types of them. We have the stable angina and unstable angina. So angina is pain in the chest. For those of us who are lay, sometimes you walk, when you start walking fast, you start having pain in your chest, and then you have to stop. And then you stop, it settles. And then you start walking, it comes again. So that's an angina. So there are 2 types of them. So those are warning signs for us, in all honesty. And then there are other things that can cause problem with the heart, and the heart stops. So when the heart stops like that, like I said, you cannot leave it up to 5 minutes because the brain is then short of oxygen, right? So how do we then what do we then need to do? Okay, so there could be a problem with the heart. It could be a problem with the lungs as well. The lung can have a problem that will lead to, an arrest. Like I said, if you don't have oxygen supply to the body, then the oxygen is going to get to the brain. So look at a situation where somebody is choked, for example, as simple as that. Somebody is choked. If you don't do something immediately, they're going to just arrest in front of you there, because the brain will not get oxygen, and that means they're not getting oxygen into their system. So it can be a problem with the lung or a problem with the heart, right? Now, I've talked about this. There are two that, I mean, these are more for medical personnel. So we know what we call acute coronary syndrome. I mean, this is one of the commonest cause of, cardiopulmonary arrest. And the interesting thing about this is, when we said that resuscitation is key, with resuscitation, we can jumpstart people's, who are in a collapsed state or who are arrested, for them to continue life process. It is better for us to prevent getting to a situation where somebody needs to be jumping, to when we need to start starting people's hearts. And to do that is understanding situations that can happen in our hearts. Unstable angina is a situation where people also have chest pain, but in this case, there are different types of them. The problem with unstable angina is people have pain. Even without exertion, you can have pain. Simple exertion, you have pain that then goes on and on for like a day or so. But when we look at some investigation, we don't see, I mean, when we do some things like the heart tracing, we don't see, signs, major signs of heart problems. Sometimes for people who are medical, it's difficult to go a balance here. You can have T-wave abnormality, you can have ST depression, but obviously they're just sort of things, but you just have pain that's persistent. This pain can be, reduced by way of using things like, GTN spray or things like that, but they need to be referred to the cardiologist. And the proper heart attack is when somebody have things like ST elevation or non-ST elevation, and that's for the doctors or the clinicians. So you do ECG, a new onset of changes in their ECG can then give you those signs. I'm not going to go too deep into them before I digress from what I'm supposed to do today. But this is important for us to know that we need to prevent this. Preventing it can be by way of talking about, exercise, especially if you have risks. Talk about smoking, reducing that, looking at our BMI, see how we can just manage this to be in a normal shape. Look at what you're eating in terms of the atheromatous plaque that we can accumulate over a period of times and so on. But that's not the point of my discussion today. So all those can lead to cardiac arrest. So when the arrest happen, then we need to also quickly know how we need to, jumpstart the heart. Jumpstarting the heart is like bringing a mechanic to mechanically start working on the heart. And so what do we need to do there? We need to make sure that we mimic the heart function and also mimic the lung function mechanically. And that's where chest compression becomes very crucial. And then when we're doing chest compression, what you literally are doing is to try and press the heart so that it pumps, whatever content is in there. And we'll talk about details of that in a minute. And it pumps that to, to different parts of the body. And then we give, rescue breathing to mimic the lungs function. So you're mimicking the lungs function at the same time mimicking the heart function, right? So there's what we call the integrated community response. It's very important for us wherever we are. And I want to speak to Nigerians now because, in all honesty, I've been here doing this training now for a couple of years or so. And I've seen all sorts of things. Even colleagues, we need to pull our socks. I'm talking about even doctors, nurses, pharmacists, and all the, those people that work in the space of healthcare. While I was doing my training in the UK, I can always remember this case of a young man who came into the department. I think he's been having, shortness of breath and things. And I just walked out. I was a registrar in emergency unit. Then I walked out of the the department. And right in front of me, the young man that was standing in front of the receptionist just dropped on the floor. He collapsed. And I just saw him twitching, and I quickly went to him. Exactly what we did today was what we're going to learn today is what I did. And I realized that this guy was in cardiopulmonary arrest. So, you know, chest compression. I got an AED, and then realized it was in ventricular fibrillation, shocked him once, and this guy came around. Of course, we didn't send him home. We had to keep him in the hospital. And then eventually had a revealed device inserted because he had some abnormality in his heart, and he went to, I'm sure it will be somewhere in Derbyshire now, probably playing football if something else hasn't happened to him. Now, and then I've seen all sorts of things happen here in Nigeria, whereby a lot of them on social media. I think the latest one was the last one I saw was that preacher who was on the pulpit, and then one way or the other was talking about the witches and the wizards, and then he just dropped on the pulpit and died. And then people were just shouting and hey, wow, they're putting water in all sorts of things, you know. We need a lot of enlightenment for the public around this. What we need to do. I've seen a lot of, you know, people in the school area. One woman dancing, and she collapsed. And mommy, people were just shouting, pouring water. People, I mean, it's just a lot of them, staggering. We need to learn to do the basics. Doing something by way, even if it's the chest compression you learn how to do, is better than you doing nothing, because the worst has happened. You do not do something, that person will die. And this is where the community response approach then becomes very vital. I always tell people here in Lagos, in your estate, can you bring out a group of people? Let's train them. Let one person be able to support the other. You understand? We don't have insurance there. You don't have all these things. You need to learn to hold your community safe. I was in my estate sometimes back, and then that was about 2 years when I first came, 2-3 years when I first came to Nigeria, and I saw everybody calling me. I rushed, they called me to come to the poolside. By the time I rushed to the poolside, I saw a young man, 35, I think it was about 35 years old then, stone dead on the floor. They pulled him out. I think he drowned. They pulled him out. Nobody didn't know what to do. To do a compression, nobody could do. By the time I started compression, I knew this guy was completely gone. Just try my best. He didn't make it. A young man, that was the guy that was taking our, you know, collecting all these dues and things. Very painful. And nobody could do anything. They were just looking, someone would come and press on the chest and walk away. So there was no coordination. We need to have a system in our community whereby if somebody collapses, we're able to recognize them early. We have a way, no matter how rudimentary it is, we need to have a way of supporting ourselves. Maybe you train some of your, you know, people around you, it could be a workplace, could be, train them to know how to do this basic thing. Chest compression, deliver where it's safe, deliver rescue breathing. And then we need to learn to use AED. AED is there's a shortage of AED in Nigeria. Now, since I came, a lot of people that have trained have gotten in their facilities or various places. We've managed to get quite a large one, but we need more. More places need to get, and they're not expensive. If not for the change in this pounds-dollar thing now, it was quite, I think it was affordable. Last time I tried to get, I think the price is now staggering and scary to me because it just doubled in a matter of 2 months. But having said that, it's something I think we need to look at, because the more we have, the likelihood that we have this community support that, you know, can save people's life. And I will talk a little bit more about that as we go on. Right. There's a chain of survivor that we need to know. The chain of survivor, like we know for any chain, and the strength of that chain is the strength of the weakest point, right? So if you pull a chain, it's going to break where is the weakest point. So we need to there are 4 components here. It's extended now, and I think it's getting more and more in terms of the number of change that we need to add. But I think this is quite basic for me to deliver today's training. We need to make sure that our people know how to recognize issues early and able to call for help. Why do we need to do that? We need to do that because we then prevent cardiac arrest. And what do I mean? I'll give an example. I had a staff who worked with me, and one day I go on outreaches, and then we went on an outreach, and I looked at, we did check blood pressure, check all the basics, and I checked this guy's blood pressure, and it was very high. And I said, look, boy, your blood pressure is high. Have you had blood pressure before? He said, no. It's okay. You need to see someone because we checked it once. I can't diagnose high blood pressure now. We need to repeat it again. It's a sustained high blood pressure that we call. I educated them. And I said, okay, when you get home, check it again or go to your doctor tomorrow. And then I saw him a week after or so. I called him. Have you checked your blood pressure? He said, yes, somebody has been coming to my house to do it. One of the, maybe, he said they have seen his doctor. And then there's a plan. And then somebody comes to their house to check the blood pressure, and it's been fine. All right? I left it. And then I asked him again one day. He said, it's okay. The blood pressure is fine now. Doctor said, no problem. This is in Nigeria. And one day, about a month or 2 after, he called me and said, sir, I was coming to work. I felt dizzy. And I had to go back home. I said, go and see the doctor. He said, I gave him milk. It never happened before. It was the first time. You need to go and see the doctor. He said he went to see the doctor, and then they said everything is fine. He said it's malaria and typhoid. The usual diagnosis there. Everything is malaria and typhoid. Now, he was treated. He went to a health center, and again, one other day, I saw him. I said, "You're not looking right, this man. Have you seen the doctor?" He said, "Yes," and I was again. I told him to go and see the doctor again. I really don't want to treat any of my staff or things. So he went, and this day he was admitted. They said the malaria parasite is high. You're not running temperature. You just look toxic. To me, you see somebody that looks toxic. Anyway, cut the long story short, this guy then went. One day was coming to work again, collapsed. And then they took him back to the health center. Then he showed me a video, and they put a cannula here. He was getting a drip, and he was breathing heavily. So, boy, something is wrong. So I said, can I speak to the doctor? I spoke with the doctor and I said, look, this guy sounds so breathless. Have you done chest x-ray or whatever? I'm just asking, please, he's my brother. And he said, oh, they've not done chest x-ray. It's malaria, it's typhoid. Please, can we check the chest? They did the chest x-ray. I insisted I wanted to see. His heart is as big as the whole of this, the x-ray film. And I was like, wow, this guy is in heart failure already. And he agreed with me. So I said, okay, please, can you send this guy to a cardiologist, or at least an hospital where they can take care? This is a health center. This is where we start having issues. Attitude. Anyway, eventually he agreed to send him to a doctor. But instead of sending him to a teaching hospital or whatever, sent him to another hospital close by, a private hospital. So I insisted speaking to the doctor there. Are you a cardiologist? He said, no, I'm a general practitioner. I said, please, I beg of you, this boy is sick. Do you think you can take care of him? Oh, we'll take care of him here. We'll get a cardiologist to review. I said, when will the cardiologist come? He said, maybe in 2 days, 3 days. I know you and I know that boy will die before 2 days. And I pleaded. He didn't like it. So eventually he agreed to send this boy to an hospital. So send him to Lassus. Well, after I called him, I said, between you and me and God, do you think you can handle the case? He agreed, send this boy. But then on sending him, he withdrew the referral notes. They got to Lassus, they were not going to see him. Anyway, a long story I had to put away. It was saying he has been, his two kidneys had gone, as in completely shut down. It's the back foot of it that's giving him this heart failure and things. And then we now started looking for kidney. Imagine. And the first time, why I said this is early recognition and to call for help in any situation is very important. Somebody comes to you and says they have a headache. they're on anti-diabetic medicine. You're not thinking that this person might have hypoglycemia. Ordinary Coke will prevent this guy going into cardiac arrest. You refuse to identify that. You leave them to go linger on for some time. Often it could be being under your care in the hospital. You understand? Nurses, doctors, under your care. If somebody that have a headache, you think your own is too much. You're asking for too much all the time. Meanwhile, this person is giving you a warning sign. If you fail to recognize at that stage, what will happen is this person will go into cardiac arrest right in front of you. Well, let's say we have missed it. We need to also train our people to be able to initiate CPR, to be able to identify and initiate CPR to buy time. The idea is to buy time. If it's on the ward, you have to buy time and then get more of your colleagues, maybe any people, the medical team, to come and support. So you buy time. Like I said, 5 minutes is all you have, maximum 5 minutes. After that, this person is going to go into brain death. So we need to be able to initiate, CPR early. And then early defibrillation is very important. Defibrillation is after you've done your let's go back to the mechanical issue. When mechanics try to jumpstart your car, it doesn't work. They say, oh, this is not a mechanic problem. It is a rewire problem. Lamidi the rewire. They destroy my car. That's what I always talk about. Lamidi the rewire. Who use his mouth to tear all the wire in my car, and the car cannot move again. So, but this time around, you will not be the Lamidi rewire. You have to learn to use AED, automated external defibrillator. We're going to watch some videos today that will show us how to do some of these things. Now, the reason is sometimes the problem with the heart that is led to this collapse, it's not ordinary occlusion of the blood vessels. There are tensions, wire that comes in the heart. We remember from our SA node, to AV node and Purkinje fiber, bundle branch and all that, right and left. So those things supply the heart by way of wire. There could be a failure. Sometimes the person that felt dizzy now could be like, maybe one of the wire is not working, or two of them is not working, and then there's only one that is working. That one then fails, and then they feel dizzy, and then you keep going. It's a warning sign. You understand? Until when the last one fails, and then you now need to be jump-starting the heart and all that. We need to learn to do all these things, and this is why it's important to learn to do basic life support, as we're talking about. Now, once we jump-start or we've actually resuscitated somebody, we must know that you cannot send this person home, whether it's in your pharmacy,
Dr. Ogunremi, we can't hear you. Can anyone else hear him?
No, I can't hear him.
All right, I think the wire cut out there as he was giving the example. So let's give him a minute to join back in. As he was saying, we must know the warning signs. Everything is not malaria and everything is not typhoid, so we must know the warning signs.
Hello.
All right, you're back, Dr. Ogunremi. You lost your wire cut too. So
yes.
As you were talking about wire, your wire cut. So
yes, so the wire cut actually,
yes.
It did cut and cut badly. So I've switched to another internet now. So basically, wire can cut, like the wire just cut. So now, when the wire cuts, it's important for us not to just assume that that's okay. We need to get this person to be seen by somebody, right? So what I've talked about so far is early recognition and call for help if you think there's an issue. That prevents cardiac arrest. If you meet that and they not collapse in front of you, you should be able to identify collapse cases and initiate cardiopulmonary resuscitation. In that way, you're buying time. And then a lot of it was some of the time, it might be wire problem, shock them. We will need to, we'll be introduced to AED later, and then you shock them. That's jumpstarting the heart. And then when they come around, if they ever come around, we'll talk about how to put them in a recovery position and then send them into the hospital. Don't send them home, right? You send them home, you're delaying the evil days. So I'll leave this at this stage, and then let's go to the next thing. Right. Now, how do we then jumpstart people's hearts? The business of the day, right? So what we need to learn is we need to learn an algorithm here. We need to know how to recognize that somebody is unconscious, right? That they're not responding, right? And then that they're not breathing normal or they're not breathing at all. When that happens, we need to have a system in place where we call for help. That calling for help might just mean like there's one Dr. Bayo behind or Mama Said behind that can actually help us. I say that because in Nigeria, you might be waiting for an ambulance for like 3 days and it doesn't appear. So you must have to improvise around what you do, right? So you need to learn how to call for help. That help might be somebody close by. It might be whoever. We'll talk about that. And then once you call for help, you then need to learn to start chest compression. And we need to do 30 compression. And then after 30 compression, you give 2 rescue breathing. And then you then go ratio of 30 compression to rescue breathing. You continue that until help comes or the AED comes or something, we'll talk about details in a second as well. So this is the European Resuscitation Council algorithm. It's pretty similar across all the council. Now, whenever you are called or you want to resuscitate someone, remember, never ever must you resuscitate someone without checking for safety of your environment, please. And I say this to people, safety is key. If you're on the plane, they will tell you that if the pressure drops and then your oxygen bag drops, fix yours first before you fix for your child. It means that safety is key. You have to be selfish about safety. Why? If you want to resuscitate somebody and the person is in danger, maybe by roadside on a highway, that is like signing the death sentence. You have to find a way of taking them from that side to somewhere that's safe. I'm just saying. It could be that this person that is collapsed, maybe they've touched an electric wire and they collapse on the floor. If you go and touch them without looking at the environment that is safe, double jeopardy, God forbid. So it's important for you to look around very well. Is there anything? Is there blood on the floor? Is there water? Is there anything sharp before you approach this person? So if it's safe, then you can approach, right? When you approach the person, there are things that you need to be looking out for, just like I said earlier on. And if you find anything that is making the environment not safe, then you need to obviously make adjustments so that the environment is now safe for you. After you've confirmed the environment is safe, you want to be sure that this person is not that they're just sleeping, because it could be that the person is sleeping, right? If somebody is sleeping and you go and start doing, Dr. Graham said I should do chest compression on you, please, you are on your own. You need to learn to identify when to say that somebody is not responding, okay? An unconscious person. You cannot start doing chest compression on somebody who is conscious or who is at alert. How do we then check for consciousness, right? Now, okay, let me use this. Okay, so we're going to use some senses in our body. The first thing is as I'm talking to you, all of you that on this that I can't see you, but at least I want to believe that you are alert. You're alert because you've taken time, you know the time that this is happening, you've logged in, you can hear me. You're aware of your environment. So we said that somebody is well-oriented in time, place, and person. You know who the person in front of you is. You know the time of the day. Not like I ask you what time is it, and you say, I think is midnight at this time. Then there's a problem. Or I said, who am I? I'm talking to you. You look at me and say, oh, you look like God. Then there's a problem. Do you understand? But if you're able to recognize me as a human, possibly you think I'm a trainer, you recognize your own environment wherever you are. So you are alert, right? So that's the first thing. As we are here, we are alert, but something can happen. That level of alertness can drop, right? It can drop by way of, when I talk to you, you're hearing me. I could ask you, do you know where I'm? And then you sound confused. You can be confused. So confusion can happen. This happens often in people, maybe elderly age, they have small infection, could be chest infection, urine infection. They're slightly confused. Some of them pleasantly confused, actually. You understand? So you then say, okay, this person is confused. They're not at alert. They are confused, but they're not unconscious. One, that's two. Now, the other thing that can happen is this person might not be confused, but you talk to them, like you call them, can you hear me? We've got 2 ears. You call them to one ear. Can you hear me? Can you hear me? They're not hearing you. It means that they're not responding to verbal stimulus, right? Now, let's look at the scenario when you then call them and say, hey, can you hear me? Can you hear me? When you call them, they say, and they sleep again. And then you call them, can you hear me? That means the person is responsive to voice, right? But they're not alert, right? So level of consciousness is dropped, okay? But in a situation when you call them and they do not answer you at all, you call them first ear, second ear, they're not answering you, then the next thing you want to do is to do a deeper stimulus. A deeper stimulus could be like, you might not just touch them and tap them on both shoulders, like that's a deeper level of stimulus. If you tap them and then they then say, and sleep again. And then you tap them, they say, and sleep again. They're responding to pain, but they are not alert. So the level of consciousness is deepened and is quite bad one, because they're not responsive to voice. They are responding to deeper stimulus, but they're not really at alert. So, but if you tap them and they're not responding, so now they're not responding to voice, they're not responding to, to pain. In that case, you can say that this person is what? Unconscious. You can then say they are unconscious. So that's how to check for response on a scale of what we call the AVPU score. It used to be AVPU. Lately, they put a C, so it's AVPU. So ACVPU, AVPU score. So in those days, when I was in medical school, we would talk about GCSE, and that thing tormented my life, I remember. But now, you can just use, if you tell me, I've seen this person, this class is on V on AVPU scoring system. I know that it's not bad, but I need to be there now. But you say it's P, which means that it's, when you stimulate him or simulated him, it was only on pain that they responded. I know there's a major issue going on there. I need to dash it. Otherwise, they dip into unconsciousness. But you say that you on AVPU score, that means they're unconscious, right? And then, so if somebody is unconscious, does it mean they are dead? No. There's still other part of it. We talked about, characteristics of living. The other thing is, Are they breathing? You want to check, are they breathing, right? So let's go. This thing is hanging here, right? So you need to check, are they breathing? So to check whether they're breathing, you need to open their airways. To open an airways, you have to do what we call head tilts and chin lift, like this lady is doing in there. You tilt their head backward and lift their chin as well. So when you do that, you open the airways. If you were to be at the center, there's some maneuver I'll ask you to do here, but it's okay. Let's just move on here. So healthy chin lift, and then you then look, listen, and feel for breathing. You do that for 10 seconds. You listen for breathing, you feel for breathing, and you're looking their chest and or abdomen, whether it's rising and falling for breathing, right? So when you do that for 10 seconds, if they're not breathing, then you can comfortably say that this person is collapsed. They are in a collapse state. They're not conscious and they're not breathing. So they're in a collapse state now, right? You must call for help at this stage. Never must you start resuscitating somebody at this stage, because if you do that, even if you are physical, after 2 minutes of effective resuscitation, you cannot bring somebody. If you don't, after 2 minutes of effective resuscitation, you will be tired, even if you are physical. So you must call for help, right? Because like I said, you have 5 minutes. If somebody collapsed right in front of you now, you have 5 minutes to do whatever you need to do. So within 2 minutes, you can assess this person and say, okay, this person is in a collapse state, and quickly rush out and call for help. How do you call for help? Just shout for somebody. Hello, who is there? Somebody. If you know their name, call them. Call their name. Matthew, please. Somebody is collapsed here. I'm going to start chest compression. Please, can you call for more help and bring AED if it's available? AED on your way back. So you quickly tell them, and then you're rushing back to commence chest compression. Okay? So you then start chest compression, right? So you need to start chest compression. So let's just recap. What I've done so far is to talk about, you survey the environment, approach the victim if it's safe, check for responses. If it's okay, you call for help, commence chest compression, right? So chest compression. Now, when you want to do the chest compression, you need to know where you're positioning your hands. It's very easy. There are two things you need to know. Actually, it's the center of the chest you're looking for. But in a flat-chested male, we have two breasts. The nipple, if you do an imaginary line that joins the two nipples, where it crosses the middle, that's the place you put in your hands. Look at the two nipple, imaginary line joining it, where it crosses the middle. That is where you're putting your hand. So people say it's to the left, it's to the heart is on the left, put your hand on the left. Excuse me, no. Put it in the middle. All right. So if somebody's got big breast and then you're thinking about the nipple might be hanging down there, then you want to then use another anatomical positioning. If you run your hand in the middle of your chest, there's a place it just dimples. It goes down. You run it like this, it dimples. That place that it dimples, just if you put your hand there, you can feel it. There's a bone there that is making click, click, click. That's what they call the cervicosternal junction. So you put your finger just above the cervicosternal junction, and then where this hand, the upper finger, the border of the upper finger, if you put your finger there, that will be the same line that you look for earlier on. There's a video they'll show you that I did. If you watch that, they will tell you more. As it might be easier to look at that on that video. Now, when you want to do the chest compression, the question is, how many compression? How deep must you go? You understand? So you need to do, once you put your hand there, you lock your arm and then make sure that your elbow is straight. And you're using your weight rather than, some people will be pounding yam and they will be doing washing clothes when they are doing this compression. No, your hand has to be straight and it's your weight that you're using. If you watch my video on YouTube, then you see how to do this effectively, right? They'll share the links with you later. Now, so if you just lock your arm and then you gently, go on it. Now, how do we know how deep we go before we start crushing all the organs in a child? For example, I'm just saying, if you see the thickness of somebody's chest, you want to depress about 1/3 of if this is the thickness of anybody's chest, whether a child, if the thickness is this much, you do 1/3 of it. 1/3. If it's this much, you do 1/3. You just calculate about 1/3 of the thickness of the chest. That is how deep you're going. For an adult with a normal size, is about 5 to 6 centimeter depth that you are going. 5 to 6. When you're pressing about 5 to 6 centimeters in depth. And then you have to go as fast as 100 to 120 per minute. Like you're going 1, 2, 3, 4, 5, 6, 7, 100 to 120 every minute. But there is a cost and a caveat to this. When you are doing like 100 to 120 per minute, in that 1 minute, you must break it into 3, right? So you're going like 1, 2, 3, 4. As you're pressing, once you get to 30, after 30, if it's safe, you have to give this person 2 rescue breathing, right? So you do 1, 2, 3, 4, 5, 6. If you watch my video, it's easier for you. You can get it better that way. If you press 1, 2, 3, by the time you get to 30, you give 2 rescue breathing. And then you continue 31, 32, 33, 34, 35, 60. At 60, which is another 30, you do 2 rescue breathing again. And then you continue 61, 62, 63, 64, 90. When it's 90, you do another rescue breathing. So we're alternating that. So you're going as fast as 100 to 120 per minute. 100 to 120 per minute. And then you then go, about 5 to 6 centimeter in depth, right? I hope that makes sense anyway. Okay, so you continue that until the AED arrives. Let's look at, so this is it. You're going like this, 5 to 6 centimeters depth, right? So, and then the rate at which you're going, 1, 2, 3, 4, 5, 100 to 120 per minute. Okay. Now, by the time you continue this, you continue it until the AED comes, automated external defibrillators. So this is the example of the AED. It comes, you'll see that used in the video that they're going to share with you later. So this is the AED. And then application of it is clear. You just look at the pad. On the pad is shown, look at this one now, is to the left underneath the armpits, right? The second one is just underneath the clavicle, underneath this bone, the bone here, the clavicle bone, which is this bone. So just underneath it there. That's where you put the second one, right? Okay. Okay. Right. So, that is it. What we need to do about, when we come to basic life support. Now, let me say a little bit more here. I didn't know I was going straight into choking here now. So now, to deliver AED, you have to understand one thing, that when we give a shock to the heart, I talked about the way the heart can just start, when the heart is jilting, and then it's not forming good pump to pump things out. That's when maybe the nerves is not giving enough signal. That's why what we tend to do is to wipe out all the nerve activities. That's when we shock, we actually stop momentarily the activities of the heart, and then allow the heart to take charge of its, contractility from the normal way of, the normal pathway of the nerve coming together to, create that muscular contraction that then pushes blood in the right direction. So that's important. When you shock someone, I want you to be mindful of this. You have to be safe when you're shocking someone. You cannot shock someone by the poolside where there's water, because water will conduct electricity, right? You can't shock someone when there's metal, so that the metal does not carry the electricity to you. And the amount of energy that you are pushing into this person is quite a lot. That's why when you shock somebody, you see them, they just bam. So before you shock, when the thing asks you to shock, you will see in the video that I'm going to share, you make sure that the environment is safe. That, I mean, the person next to you, they are safe, and you are safe as well. When you are safe, they are safe. That's the only time you press the shock button. It's very, very important for us to know that, right? Okay. Now, let me quickly talk about choking. So, as I'm talking now, I'm talking because I'm able to breathe. If I dare you all, as you are there, to stop breathing momentarily, just hold your breath. If I tell you my name is Feb, don't breathe away now, please. Before you said, I ask you to hold your breath, and then you collapse, please. Breathe away. Now, if I tell you that my name is Dr. Femi Ogunremi, right? And I ask you to stop breathing momentarily and call my name, like stop breathing, you can't do it. You cannot call somebody's name without breathing. Once you hold your breath, you cannot phonate. You can't talk, because your lung needs to you need your lung to also be able to talk. So when somebody is choking, it means that they're not breathing. So a choking person, it will either be coughing because of the foreign thing that is in their throat to cough it up. And what do we do in Nigeria that I've seen? People will say, when you're coughing, put salt on your tongue. People say, drink water. And people say, put something on your head. I don't know. There's all sort of funny things I've heard. And it doesn't really work that way, to be honest. I think when somebody is choking, the airway is blocked, you need to encourage them to unblock that airway. So if it's mild choking, which means they're just coughing, all you need to do is pat them on the back, right? And encourage them to cough up whatever is blocking that way. Okay? So you pat them on the back and encourage coughing, right? Now, if somebody is completely choked, if somebody is choking the person and is severe, what you will notice is they will not be able to talk. You will just see, they will do like this. They'll be running after you and begging you because they can't talk. Do you understand? So time is of the essence, because this person, if you do not do something, they will collapse right in front of you, right? So there are two things that we can do. There are two maneuvers if they are severely choked. So I'm just leaving this there for you. So one of them is what we call 5 back blows. So you need to watch the movie. I've sent it's in one of the video I've sent as well. So you need to snap them 5 times at the back, in between the, just at the back, at the center of their back. You need to give them, a good push. The idea is you're pushing their back for them to cough. So when you push the back, you jolt the lungs, you push it together because that's what we do when we cough. So you're mechanically helping them to cough so that they can cough up whatever is there. You do that 5 times. If that doesn't work, then you do abdominal, you do what we call Emlich maneuver, which is more of an abdominal thrust. So you put you need to watch the movie, the video. So you put your hand there and then jolt it in, 5 times and see whether they're able to push the thing out. When you watch the video that I did earlier on, I've sent it to the organizers. So you'll be able to do this easier. So that's it. So this you have one algorithm for a child and one for an adult. So for an adult, that's it, to give them a good pat on the back to make them cough. And if you do 5 of that, you do 5 of this, 5 of this, 5 of this, you just keep rotating it until they're able to unblock whatever is blocking the airways. But the interesting thing is sometimes they are not able to expel this thing. Okay, so that's a link to the YouTube for this one. So sometimes they're not able to expel the foreign body, and then what you might then need to do is keep observing them, or I mean, you keep doing this rotation. But if they do not expel it and then they collapse in your hand, unfortunately, this can happen. If they collapse in your hand, you have to go to the basic life support training algorithm, whereby you do chest compression and then rescue breathing, chest compression, rescue breathing. Okay, so now provincially, while you're doing this, right, this person comes round, then you need to put them in a recovery position. This is better watched than just saying. You need to watch the video, that's the link, or you just type my name, Dr. Femi Ogunremi, on YouTube, and then put recovery position. It will come up, and then you can see, you can watch that. It's easier to do, to explain that way than this way. Okay, so this is I think so far what we've done is to talk about basic life support in a very nutshell, and we also talked about, an unconscious patient, and then when somebody chokes, how we can support them. And I've also talked about how to put someone in a recovery position. So on that note, I want to say thank you for listening to me for the past 1 hour. And I will hand over to Flora, and maybe we have another 5-10 minutes for questions. Thank you so much.
Thank you very much, Dr. Ogunremi.
Thank you so much, Dr. Ogunremi.
If anyone has any questions, please raise your hand and I can take a few before he goes. But while we're doing that, Dr. Ogunremi, please could you stop sharing for a second?
Sorry.
Thank you.
Wait. Are you okay? Oh, sorry.
Yeah.
Think...
So while we're so before we do the questions quickly, could I ask Mr. Israel Balogun to please unmute himself?
Hello.
Mr. Balogun, could you please put your video on?
Hello.
Dr. Ogunremi, I can still see your.
Sorry?
I can still see your presentation.
Yeah, that's what I'm trying to. I'm just.
Thank you. Perfect. That's it.
Yes.
All right. Okay. So before we go to the questions, just quickly, we would like Mr. Balogun he's going to talk to us quickly, briefly about his organization. So, yeah, thank you.
Can you hear me, ma?
Yes, we can. So just quickly talk to us about what you were going to talk to us about.
Thank you so much. I appreciate the opportunity to speak to these humble and wonderful people. My name is Israel Balogun. I'm the founder of Akin. Akin is an organization in Nigeria that is saving children and young adults from the streets. Since 2019, we have been saving and providing scholarship for them. Our program is rich between taking 15 of them per year to take them through remedial class and rehabilitation. After 6 months of remedial and rehabilitation class, we work with the families, looking at the families that is suitable for the child to go back to. And with the help of government, we usually reunite the children that we find out that have a good family, non-toxic home, and we take them back there. Then we enroll them in schools, and then we sponsor their education onward. But those that we find that they don't have a place to go to, the government will give us permission to keep them in our center. I also did not just start this program. I also was on the street for 12 years, at the age of 10 to 22 years. I could not read or write until I was 22, but I left the place. Somebody also took me off the street one day, and I was able to go back to school. Can you hear me, ma, please?
Yes, we can carry on.
Okay. Somebody was able to, somebody took me out of the street, and then I've gone to school. I have masters in behavioral modifications, and I'm a professional cinematographer. We carry this program out with homeless children and young adults based on my own passion and my life experience as well. And then since 2019, we have helped 28 of them. So I spoke with the organizer of this program concerning our next year program that is starting in January. We are piloting 15 of them again, where we will take them into our remedial class, prepare them to go back to school, rehabilitate them. And more than that, we also provide a platform for them to tell their story using storytelling system. The storytelling system is a medium in which, it's a system we use to sustain their interest in the class, because apart from this, none of them will want to stay there learning how to read or write, how to know basic mathematics. We need something that will make them to develop interest. And so we use storytelling, and the storytelling is about their own life story. Not only that, do we use that for them, we also use their story to address the grassroots of the problem that is making many of them end up on the street. So this is what we do with them. And I spoke with the organizer that would love to pitch my project with the wonderful people here to see how we can collaborate with individuals who are interested in our program. Thank you so much.
Thank you so much for that. So if anyone is interested, the details for Mr. Balogun are in the chat. If we can support his organization in any way to take children off the streets. Thank you. Okay. So I did say we'll take questions after Mr. Balogun, but Dr. Oguremi is actually going to demonstrate for us now the CPR process. So I'm just going to go back to him. Please, in order for you not to forget your question, just type it in the chat, and then when we come back to questions, it will be there, and I'll ask you to raise your hand. So Dr. Oguremi, so back to you. Are you ready? Yeah. If you just unmute for me. You're still on mute.
Okay.
Yeah, I can hear you now.
Right. Okay, so guys, I'm going to just quickly demonstrate this in 1 minute. What you need to be doing if somebody claps. Sorry, this is in my office. It's not my training room now. So I don't have much space. This is Mr. Bobby. He's one of my friends. I have quite a few of them around here. So if Mr. Bobby is collapsed, like I said earlier on, we need to check for response. So checking for response, you call them. Hello, can you hear me? Hello, can you hear me? So he's not answering me. He's not answering me. So I can say comfortably that this person is not responding. Then I check for breathing. Head tilt, chin lift. Look, listen, and feel for 10 seconds. And 1, and 2, and 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10, and 11, and 12. You understand? Sorry, for 10 seconds. I've gone for 12 seconds now, but honestly, it's supposed to be 10 seconds. I just got distracted there. So 10 seconds, they're not breathing. So now he's unconscious, he's not breathing. I can comfortably say that this guy is collapsed. So you'll notice when I'm counting, I break it. If you look at the amount of seconds, like and 1, and 2, and 3, it doesn't go 1, 2, 3, 4, 5, because in emergency, you can say 1, 2, 3, 4, 5, 6. You don't die. Calm down. You never die. You understand? You have to count to time. So once that's happened, then you need to call. Hello, David, somebody's collapsed here. I'm starting chest compression. Please, can you bring AED and call for more help when you come? So then I will start. I'm not going to break my chair. So I'm going to start, compression. So 9, 7, 11, 12, 13, 14. So you count like that until you get to 30. So at 30, head it, chin lift. Then you breathe into the mouth. Okay, so head it, chin lift. 1, 2, and you continue. 1, 2, 3, 4, 5, 6, 7, 8, 9, 20, 30. So you do 30 again. 1, and you continue again. 1, 2, 3, 4, 29, 30. So you're doing 30 to 32. And you continue that until AED comes. When AED comes, you position it. We're doing a training somewhere else, so the AED that I could have used is not here now. So you just plant your AED there and one here, and then you shop them if it's safe to do so. Please watch the YouTube version. It's quite comprehensive, but that's the simplest way that I can explain it in this tiny space. I hope that's okay for now.
Thank you so much, Dr. Oguremi. So we'll go straight to the questions. Dr. Madu, please unmute yourself and ask your question.
All right. Good evening, everyone. Please, am I audible enough?
Yes, you are.
Good evening. Okay. Thank you, the organizers of this program, and Dr. Oguremi for the detailed presentation. Please, I have a concern. Actually, I've done this training some time ago in year 2011. And of course, I've never gotten a victim, God forbid anyway, that collapsed for me to practice what I learned then. But my concern is that, number one, I'm calling from Nigeria. Sorry, can you still hear me? Sorry.
Just about, keep going.
Okay, so what I'm saying is that in Nigeria, I'm aware that the availability of AEDs is not common anywhere. So the issue of calling for help, by the time I get a collapsed victim, I may be the only one, as I know is common here in Nigeria. I may be the only one that is even trained in CPR. And I'm calling for help, telling people to bring AED. I know no one may have any AED around. And so my question is, and the first question I have is, what do I do in such scenario? Because I know in most cases, people will say send to the hospital. So is it not better, maybe when I know that there won't be availability of AED anywhere, I start my rescue breath or CPR rather, and then as they bring a vehicle, we start rushing the person to hospital. I don't know if that is right. Anyway, I'm just asking what is the best thing to do in that situation. Then another concern I have is about the compression, that you have to depress the chest. I think you said about 5 to 6 centimeters. I'm always afraid when I try to reason the distance of 5 to 6 centimeters and putting all your pressure on the person's chest, whether I won't wound that person. I don't know if it can be better explained. Thank you.
Okay.
Thank you very much.
Thank you, Dr. Madu. Please let me just, because of the time, I'm so sorry because I'm pressed for time a little bit today. Let me start from your last question. This is 6 centimeters depth. This is about 6 centimeters, 2-3 finger breadth. So about 2 centimeters. That's about 6, maybe a little bit more. Now, first thing is, if somebody is collapsed, if you do nothing, they will die. Do you understand? Don't do anything. You'll be standing there. They will die right in front of you. Nothing else. They will die. So that's one thing. It's better you do something. The worst thing you will do, your fear, is you're going to break their ribs. Break it and bring them to the doctor. Doctors will tell you, I'll fix it. It's not a problem. To fix people's ribs is not a problem. At least make them alive. Do you understand? So please, don't, and then if you're doing it like this, I don't want to break it, you're doing nothing other than killing them. If you don't, that's what I was talking about, effective chest compression. The purpose of the chest compression is to press the heart to act like a pump. You press it to act like a pump. Do you understand? So if you don't do it effectively, what you're doing is like this. The blood is not getting out of the heart. You have to put that in your head. It's like you want the blood to come out of you're pumping this time around. So if you don't depress it enough, you're not pumping. So there's a breastplate here, which is a plate here. Breastplate, this plate. That's what you're using as a lever to press the heart down. And if you don't do that, you're not doing an effective thing. The oxygen is not moving. So you have a stasis of carbon dioxide. The brain is going to die while you're there fiddling. Do you understand? So you got to do it. Please, your first question. I think I've forgotten it now.
Let's go to the next one. Is the rescue breath, that is mouth to mouth, advisable in this era given the COVID pandemic?
Sorry. So the rescue breathing, I would suggest that you can do what they call the hands-only compression. Hand-only resuscitation. If it's not safe to do rescue breathing. Do you understand? It is effective. It's not as effective as you also giving them rescue breathing. And if you come from my training, there are some other some other things I can introduce to you. I don't have them here, which we use, those barrier way of delivering the rescue breathing, which protects you from things like, COVID and things like that. But like I said, safety first. If you think the person is not safe, please don't seal your mouth and then go and infect yourself. You can just do hands only. If they are still pumping the heart, if the heart is pumping and you're circulating, the blood is still quite effective. And there that's one thing that the council is recommending in a situation when it's not safe to do mouth to mouth. I might have to go now, please.
So just one last question. How would you assess healthcare practitioners' attitudes towards BLS in Nigeria, and how often should you be having the BLS training?
So BLS training you need to do BLS. Well, in the UK, we do BLS training but every year, to be honest. But in Nigeria, even if you can't do every year, do every 2 years. But the European Resuscitation Council standard is you do every 3 years. You do it once every 3 years. I remember I think Dr. Madu was talking about the fact that he hasn't done it for a long time.
Yes.
So we need to keep educating ourselves. We have to enlighten. I remember his question is, the person next to him might not be skilled in basic life support.
Yes.
Which is true. My first thing is, those of you that have listened to me today, please, whoever is around you, train them. You know why? If you collapse wherever you are now, you can't help yourself. As I'm here, if anything happens to me, no matter what I know, I can't help myself. So you have to train people around there. And that's why I agreed to coming here to do this today. God knows, because you have to learn, you have to teach others, learn and teach others. And this is the only way we can then increase and propagate that, and that's one thing I think I'm doing in Nigeria. In all honesty, I've trained hundreds of people on this thing. I don't mind going on the air to do it. I don't mind, but teach someone, because that person is the one that will rescue you if that happens. So we need to create a lot of awareness. We need to do more of advocacy, all of us. It's not about Dr. Ogunremi alone, including all of you that listen to me today. So it's just one thing that we have to keep doing. And then people that do not understand what you're doing, you just have to train them. We just have to get more people to get trained about this. In terms of the AED, I can say comfortably at least about 50 AED I've managed to get to secure for people here in Lagos. You understand? And as awareness we're creating more awareness, more people will be get for your own facility. Dr. Madu, let other people get for their own facilities. That is how we start growing. In the UK, where we have it virtually everywhere, it didn't start in one day. It's something that we have to build. A change does not happen, bam. This is a process of change for all of us. and it's a job that we all have to put our hand into. I really have to go now. I'm so sorry. I have another presentation somewhere, and there are hundreds of people waiting for me, and it's a big conference. I'm on a panel. I'm leaving late now, please.
Thank you so much, Dr. Guremi. We have somebody here who has survived a cardiac arrest, and she's going to speak to us now and give us her experience of what happened. I believe it's Adaobi Oyekweli. Are you here? If you are, please raise your hand so I can ask you to unmute. Just unmute yourself, please. Okay.
Okay.
Yes,
Hello.
go for it, please. You have 2 minutes. Thank you.
Yes, my name is Adaobi Cornelia Onyekweli. 5 years ago, I suffered a cardiac arrest at home. There was no warning. It just came like that, and I was very healthy. By the time when it happened, my children were in secondary school, and nobody could perform anything. What that doctor said was true, because everybody will have just let me die. By the time the ambulance came, I was dead for 10 minutes, and they quickly did the CPR. So I think everybody should learn about that, because I ended up having 5 cardiac arrests, and that experience taught me that we all need to learn how to save another human being, because we just sit there and the person will die for nothing, and we blame village people. Sometimes there are things we can do for ourselves. Because of that experience, I have been able to, after that happened, I said, I'm not coming to Earth to waste my time. I opened my own business. Things I should have done since. Why did I wait till I nearly died? I opened my own business, and I help people I'm a recovery coach for people on long-term illness. And my company is called Put You First Limited. We help to supply AED to people. And I like the person that talked about it to reach out to me through Dr. Andrew Ago. I'm raising AED machines for people. Today, because of my experience, I've been called on stage to graduate. So I'm now Dr. Adobe. And all this happened because I survived cardiac arrest. So if people did not learn how to do CPR, I would have just been dead. So please, this is very important. And anybody looking for CPR should reach out to me through Dr. Agbo. So that's what I want to say. You can see, we've just finished graduation. I'm now a doctor today.
Congratulations.
And it's very real. People die for nothing just because we don't know what to do.
Thank you so much for sharing. That's amazing. And congratulations to you. That is amazing. We still have other doctors online. If you have any questions, you can raise your hand. Or if you want to ask Dr. Adaobi now, if you want to ask her any questions,
today I'm a doctor.
Yes, you can raise your hand and ask any questions. We still have other doctors online who can take your questions because Dr. Guremi had to rush off. So just raise your hand or pop it in the chat. And I'll ask you to unmute. Makes it easy for me to find you. Anybody? Any questions or comments? Dr. Agu is on the line. He's the founder of Gintervenes Healthcare Foundation. So he can take some of your questions. Or anyone has any comments? Okay, Sister Ajayi, go ahead. I've asked you to unmute.
Yeah. Once again, I want to thank the organizers of the program and Dr. Guremi for his dexterity in carrying out all the projects. I admire the various lessons that I have come to learn because he was able to break it down to the level of non-medical people, which I am one. However, there are still things to be learned. And that is why I would want him to give us where to reach him. He mentioned something about YouTube, something. Majority of us may not be versatile when it comes to accessing whatever, all these pressing buttons on the phone. So WhatsApp, things like that. I can do that. I can get WhatsApp. I'm on Facebook, maybe. But all this YouTube thing, I don't know. It's a new thing. Maybe I'll ask someone to get that done. But nevertheless, I need that go ahead. However, there's just one thing that I'm going through, which I need his clearance. He mentioned something about shock. I don't know when he was talking about it. I have arthritis, and part of my physio lessons, something is administered on me that causes electric shock. And it has been a quarrel between me and my physio handler that I will not use that object, whatever it is meant for. Whether it will save me from the arthritis condition, I don't care, but I can't use it. What good will shock make to a septuagenarian? And is it really necessary? And is there an alternative to shock in that condition? Thank you once again.
Thank you, Sister Jai. Dr. Agun, I would ask you to take her questions, please.
Hello, Mrs. Ajayi. We know each other. We'll go a long way.
Very, very well.
But the type of shock Dr. Guremi is talking about is very different. When he talks about shock, he's talking of total collapse when the whole of the body is not working. Okay, either from an electric shock, you know, like electrocution, that is different from what a physiotherapist will be using for you, which is almost like using like a kind of radio wave or something to heal with pain and all that. So it is actually very different.
Okay. Thank you. Thank you.
Great. Okay. Do we have any other questions or comments? Or do we have any other healthcare professionals who want to contribute to the questions that have been asked? If you would like Dr. Ogunremi's contact details, I've put it in the chat. Just send an email to the Jintervenes Health Foundation email address, and we'll see if we can get his details for you. Do we have any other questions?
Laura, I would like to talk a bit about what Dr. Madu asked.
Yes,
Dr.
please.
Madu, he actually made a very crucial point, which is about how you resuscitate the person. Where do you take them to? That is the gap that is seriously missing in Nigeria. In the UK, where some of us live, sometimes even as you are calling for help, part of the help is to actually call an ambulance. So technically, before you don't 2, 3, 4 minutes, the ambulance people are there to help you and take over and take the patient to where the patient can be saved. Unfortunately, in Nigeria, first of all, there's no functional ambulance service that will respond like that. And even if you get the patient to hospital, the hospital that you take them to is crucial. So if you learn cardiopulmonary resuscitation, you resuscitate them. Don't take them to a hospital where you have to be calling for the doctor to come. The patient will die. You have to take them to an established hospital that has an accident emergency department that doctors will be there and they have facilities to see the patient. If not, you've wasted your time.
Thank you. Thank you for that. So, any more questions or comments? John, are you ready to deliver your contribution, your speech? Just raise your hand so I can see where you are. While we're waiting for John, is there anyone else who wants to ask any question? Okay, we have a comment in the chat. In the UK now, we may not even have need of an ambulance with the level of NHS degradation. I hope I've read that correctly. Are we saying with the issues going on in terms of the NHS? Yeah, but at least we do have the services available, I guess. All right, John, anyone else? Any comments or questions? John, are you ready?
Yes, I'm ready. If you can hear me. Can you hear me clearly?
All right, yeah, go ahead, please.
Okay, so if there are no more questions, I'd like to deliver a vote of thanks on behalf of the Board of Trustees of Jintavines Health Foundation and our partners. We're delighted that you were able to join us for this knowledge sharing session. And on behalf of the Board of Trustees and our partners, I would like to say a very big thank you to Dr. Ogunremi, our distinguished speaker, who made the presentation earlier. It was not only very informative, it was very insightful as well. So lots of points he mentioned, he brought up that we really need to look into in the healthcare delivery system of Nigeria here. So the information he gave us today was also very critical for life-saving situations and all that. So we'd like to also say thank you to our collaborators, our perennial collaborators in Victory Drugs, Festac Town, Lagos, and in Encapsulate Healthcare Solutions as well, for all that they do behind the scenes to make meetings like this possible, or webinars like this possible. Jintavines Health Foundation, for those of us who don't know, is a health-focused nonprofit set up in 2018 to conduct humanitarian interventions in the healthcare sector here in Nigeria. Our interventions are purely charitable and free for the public, and it's made possible by donations we get from well-meaning individuals such as yourselves that are here online and other organizations as well. So you can support, and at this point I can ask you to consider making a donation. You can support what we're doing through a voluntary donation through our Stanbic IBTC account. I'll try and put the details in the chat after this. But our Stanbic IBTC account is 0028901410 Jintavines Health Foundation. I'll say it again. Jintavines Health Foundation, Stanbic IBTC Bank. Account number 0028901410. Or you can also visit, we also have an online presence as well, where you can make an online donation, depending on whatever country you are in, regardless of the country you're in. You can make a donation in the currency that we use locally and all that. The link is in the chat as well. So on this note, we'd also like to say a very big thank you to all of you that have joined us and stayed to the end. And we pray that this meeting is as impactful for you as it has been for us. And we ask that you have a very good weekend and stay safe. Good evening.
Thanks a lot, John. Thank you so much. So now I'm just going to quickly show us that video on how to help someone if someone is choking. So just bear with me 1 second.
What I need to do is to just say, Mr. David, can you cough? Cough more. So I get to cough. And I'll that's fine. Before you give me COVID. I don't go stable like this. So we will just gently tap his back so that he can cough up whatever is there. Right? Encourage him to cough because the idea is there's something going in the wrong direction. You want it to come out. That is mild stroking. Okay? But what happened, like I told you to call my name earlier on, you couldn't call my name. When I said don't breathe and call my name, it's not possible. What you will see in somebody who is severely choked is they cannot talk because it means that something is blocking their airways. So they can't talk, right? What you see them do is they'll be giving signs. They can't talk. Time is of the essence in this case. There are two things you can do. So you make them lean forward like this, okay? So you know that input part that I talked about earlier on. You make a fist and put the fist in there like that. This is the chest, this is the dimple. So I put my hand here, okay? And then you will then jack them, you know, you do this one, so once you do one, you check whether they've expelled whatever is there. I'll show you. So you do, it's called abdominal thrust, Emlich maneuver. So you jack one, You check whether there's anything coming out. Okay, if there's anything there that you can just use the force up and take it out. You do again. You do that 5 times, right? And see whether they expel whatever is there. The idea is when you do that, I don't want to do it hard because it's very painful. So when you jack it in, you're trying to compress the lungs to push that thing out. Do you understand? That's what you're doing. Now, if you do that, it doesn't, does not help. You rotate them between, this is the scapula. In between, the scapula is this and this. Again, this scapula. So you then put your hand there and then lean them forward and then hit the back. You hit it hard so that you're trying to compress the lungs. You understand? That you're helping them to cough. So you bang it and then look. You bang it again and look. Right? So you do that 5 times again. If they are not expelled, you come back again. 5, 1, 2, 3, 4, 5. When you do that, you come back again. 1, 2. So you continue to rotate it that way until they expel. But guess what? It's not all the time they expel. You might be doing that and they do not expel, and then they collapse in your hand. What would you do in that case? If they collapse? You start what? Basic life support. You lay them down and then you start chest compression like we did the other time. But this time around, don't forget that when you're doing the chest compression, you're also compressing the lungs. They might expel. You take that thing out. You understand? So it might be difficult for you to now do mouth to mouth, because if you do mouth to mouth, you might push that thing backward. You understand? So, but by the time you do the chest compression, they might expel that thing, which is what usually happens. Thank you so much.
Okay, so that was the video on choking. I will now share the one on CPR, just as a recap. Just give me 1 minute. We can still take questions if you want to ask any more questions. Give me 1 second to open this in another window. Any questions while I'm doing this? Alrighty. Okay, here we go.
My name is Dr. Femi Ogunremi. So I want to quickly talk us through how to do basic life support in real life. Now, situation happens when people collapse, and when they collapse, we need to actually confirm that they've collapsed, and then we need to quickly resuscitate them to keep them alive. Let's look at the research. Research shows that about 60% of the people that are dead now will be alive if we all know how to do this skill. So I'll run us through this. This is Mr. Bobby, who I'll use as my patient today. I've been called to see this man who is collapsed on the floor. The first thing is he actually collapsed? So to know whether he's collapsed, I need to check his response. So that's the first thing to check. But before I get in there, you have to be mindful of your environment. Like I always tell people that I train, you have to be selfish for once, and that's around safety. Make sure that the environment is safe. So when you approach a collapsed person, you don't know why they collapsed. It could be that they've actually touched an electric wire and they are electrocuted. If you go and touch them, you can be shocked. You look around for things like blood, maybe sharp objects like broken bottles, nails. Have they bled on the floor? Is it that the floor is actually slippery and they've fallen and banged their head? You need to be sure. So if you look at the environment and it's safe for you to approach, you approach the person. So you check for their response. How do we check for response? We use two, senses. That's the hearing senses, and then you look at the pain senses. So the first thing is to speak to them. We have 2 ears. You don't know whether they put something in their ear. There's plugging one side, so you need to talk to both ears. So call them. Hello, sir. Can you hear me, Mr. Bobby? Hello, Mr. Bobby. Can you hear me? So if Mr. Bobby is not hearing us, we can definitely say that he's not responsive to voice. Now we want to check for pain. So you then tap in. Check whether it's going to, just open his eye. You understand? Or maybe, so if it doesn't respond again, at that point in time, we said that it's not responsive to voice, it's not responsive to pain, so it's unconscious. Now, if it's unconscious, does it mean that it's in a collapse state or is passed on? No. So the next thing to check is it actually breathing? So we need to check for breathing. To check for breathing, we need to open the airway. When you open the airway, you look, listen, and feel for breathing. And how do you do that? You put your hand on the forehead, so you press it down, and then you lift the chin. It's called head tilt chin lift. And then you put your cheek over the mouth and nose, and then you'll be looking at the tummy, whether it's rising and falling, which is looking for breathing now, or the chest, whether it's rising and falling. Then you feel for breathing, whether they're going to breathe from their mouth or their nose on your cheek, right? And then you listen for any abnormal breathing. Now, and you do. Let me demonstrate to do that. So you head tilt chin lift, look, listen, and feel for 10 seconds. So you count and 1, and 2, and 3, and 4, and 5, and 6, and 7, and 8, and 9, and 10. So you will notice that when I'm counting, I count and I break that counting by putting and. In emergency situation, it's very easy for us to count very fast. And so 1, 2, 3, 4, 5, 6, 7, 8, 9, you don't die. No, that's not the proper way of counting. If you look at the hands of seconds, it goes like and 1, and 2, and 3, and 4, and 5. Not 1, 2, 3, 4, 5, 6. So you can't 10 that way. So after 10 seconds, if they're not breathing, now this person is not responsive and is not breathing. So you can comfortably say that this person is in a collapse state, right? So if somebody is confirmed to be in a collapse state, don't initiate resuscitation without calling for help, because even if you are very fit, if you do resuscitation for 2 minutes, you will be tired. So you need a backup. You need somebody to actually stand in there, and then for them to bring AED for you. AED is automated external defibrillator, which I'm going to demonstrate how to use for you. So after you've done this, you need to rush out and call. Can somebody help me? Somebody's collapsed here. I'm going to start chest compression. Please, when you are coming, bring AED and call for more help. So then, as soon as you've done that, you're coming on the chest to then start what they call chest compression, right? For us to do the chest compression, you have to put your hand in the right place. There are so many, things I've heard. People will say, the heart is on the left. Put your hand on the left. Somebody will say it's on the right. Right? Let's get our facts. This is the normal male chest, flat chest. Now you have 2 breasts, a normal person, and then they have nipples, 2 nipples. So this nipple and that nipple, if you draw a line that joins the 2 nipples, you say a line, imaginary line that joins the 2 nipples, where it crosses the breastplate, that's where you're putting your hand. Coincidentally, for people with big breasts, like a lady or somebody is pregnant, you can also find that line. And how do you find it? You look at what they call this cervical junction. So if you run your hand through your chest from this area of your throat where there's a dimple here, which is what we find here. If you run your hand down to the middle, you see a place like dimples, right? So if you look at me on my chest, if I run this way, that's the place. You'll feel something that is making like click. That's the cervical junction. So you put your hand on the cervical junction like that, right? Look at the upper finger, the upper border of the upper finger. So if you put your hand there, if you look at it, it's still the same spot, the same point. So that's how to get that. So once you get that point, you put your heel of one hand over that point, and then the other hand just to support and put pressure on it. Some people say, put your hand this way or do this way. It doesn't matter. Just make it firm. So you then start your compression. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So you do 30 chest compression. After you've done the 30 chest compression, you give them 2 rescue breathing. The 2 rescue breathing is given when you head it, chin lift again, You then close the nose so that snot doesn't splash on your face. You close the nose and then take a normal breath and then seal your mouth around the mouth and breathe slowly into that over 1 minute, over 1 second. Like, okay, let's try again. So head teaching lift. 1, 2. So you do 2 2 rescue breathing like that. You see the chest will rise and fall again, and then you continue 2, 3, 4, up to 30 again. Now, I need to tell you about this chest compression. When you do the chest compression, I've seen people do this. No, you don't stay there, because you need to allow, what you're doing is to allow the heart to fill up, and then you compress. So you're using the chest plate to press the heart down, to expel it like a pump, and then fill up again. Expel and fill up. So to do that, there is a distance that you will be aiming for to press down. Usually, you look at, if the chest is this thick, about 1/3 of the thickness of the chest is what you want to compress, where, you know, depending on how thick this person is, right? The other thing is, you can look at about 5 to 6 centimeters in depth, like 5 to 6 centimeters, 5 to 6 centimeters, and allow a complete recoil of the chest when you do that, right? Then the other thing that we have to know is, you need to go at the rate of about 100 to 120 per minute. So every minute. However, you break it into like 3 times. So you do 1, 2, 3, 4. When it's 30, you give 2 rescue breathing. You come back again, 31, 32, 33, 60. 2 rescue breathing. 61, 62, 63, 90. 2 rescue breathing. So over that period of time, which is about a minute, you've done about 100 to 120, but you break it like 30, 30, 30, and 2 rescue breathing in between. I hope we're clear with that. Now, once you continue that until the AED arrives, right? So now, let's say the AED is here. The first thing you want to do, put it on.
Adult patient.
Then you follow instructions.
If the patient is a child, press the child button.
So, if you look at the part,
remove
there are
clothing
signs.
from the patient's
so you will have
chest.
taken clothing out, right? It's
remove
bare
packet
chest.
and apply pads on
This
the
is the
patient's
packet.
bare skin.
Then you take this out.
Apply
This is
pads
to the
as
top
shown in the
here,
pictures.
just below the clavicle.
Remove
So you
packet and
position it
apply
this way.
pads on the patient's bare.
That's one.
Press pads firmly on skin.
Yeah, and then you remove the other one.
Apply pads
Look
as
at this.
shown in the pictures.
And then you apply it just below
apply
the
pads
the
as
nipple.
shown in the pictures.
And then you apply that.
Press pads firmly on skin.
Right?
Do not touch the patient.
So when it says do
analyzing
not
heart
touch the
rhythm.
patient, don't touch the patient, right?
Do
so
not
it's
touch the
analyzing
patient.
now.
Analyzing heart rhythm.
Okay.
Shock advised.
So once it says shocks advice,
Do not touch
this
the
is where
patient.
it's crucial. Do
Everyone
not shock somebody
clear.
when somebody else is touching them, right? You need to
Press
tell
the
people to
flashing
move back.
shock button.
Can you move back? Move back. You look at it from the
Press
head to
the
toe.
shock button
And then make sure
now.
you are safe. Every other person is safe.
Press
then
the shock button
then
now.
you shock the patient. But once
Shock
you shock them,
delivered.
immediately
Begin
you begin
CPR.
CPR again. So you continue. Oh, and this will be count for you.
10, 20, 30. Give 2
So it will
breaths.
tell you to give the breath, then you do the same. And then you continue. So you continue that and follow the instructions from this. When you have your colleagues that will be helping you in case you're tired. So every 2 minutes, this will ask you to stop. And then it will reassess the heart, whether it needs to shock or not. And then if you're tired, while it's counting, you tell somebody to come and take over. And you continue this until the patient comes round, or the ambulance arrives, or you take them to the hospital, or you decide, don't ever decide to stop CPR on your own, unless you're tired, unless you start having chest pain, or you know that for one reason or the other, you're not safe yourself. That you allow yourself and your colleagues to decide on what you need to do, whether you're stopping it or you continue. I hope that.
Okay. So that was the video, just recapping what Dr. Guremi had shared earlier on. And he is online by phone now. If you do still have any questions, and he's able to take questions. And as I said, we have doctors on the line. If you have any questions, any comments before we close, just raise your hand and we can take them quickly before we close. Anybody? Okay. Well, it looks like there are no questions or comments. I just want to say thank you all for joining.
Sorry, Flora.
Yes.
Flora, I think Sister Jai is raising her hand physically. Didn't understand the.
All right. Okay.
She has a question.
Sister Jai, over to you.
Yeah, just a comment. I remember he extended kindness by saying that anyone who lives within an estate, within a residential area, where they can invite people and teach them these things, admitted that it is a fine thing to teach people, but people prefer a medical personnel to accentuate whatever the one teaching is doing. Like we have learned something now, but without paper qualification, we cannot just rescue anybody except in emergency. Probably they will accept us. But when you want to coach them, they might as well want to ask certain questions that it is the medical personnel that is in a position to answer better. That is one. So how can we reach him whenever we have such collection of people who are eager to learn, whether it is in our village home, whether it is in our residential area, or whether it is in a forum where we have people gathered and we want to extend this kindness to them. Thank you.
Flora, I can answer that.
Okay.
Mrs. Ajayi, this is probably new in Nigeria and it has been overdue. But in the UK, what happens, most of the training is that some of it is actually done by non-medical people. And you do have some that are done by medical people who then teach people who you call first responders or people that are just trained in basic life support, and they themselves become trainers. So a lay person can learn it and then continue to update themselves regularly and then train other people. So the basic thing is that everybody can learn it. If we're waiting for doctors to be the ones that will teach us, there are almost 200 million people in Nigeria, they can't reach everybody. So the main thing, as you have acquired the skill now, you sharpen your skill, and then there are videos, people learn it is better to do something than not to do anything. So that it will spread, it will eventually spread, but it has to be people learning it, then spreading the word. And teaching other people.
Thank you.
All right, so somebody's just asked for the video placing someone in recovery position. So I will quickly share that as well for you guys to watch. So let's play that one.
Position. So if somebody is collapsed, they're not dead, they're breathing, for example, but they are unconscious. And you don't want them to aspirate and choke. So what you then do is you're going to look at the side that you want them to lay. You will lift the arm on that side. You put it, so we'll just assume that she's unconscious now. So you put the arm that way. Then the arm on the other hand, you pull it, you pull it and then put it by the cheek like this, right? And then the leg on the opposite side, you lift it up, okay? Now, once you've done that, you're almost done. The next thing you then need to do is just pull them towards you like this, and they will fall in a position like this. See, if you see their mouth, if their arm is actually supporting, it's actually supporting the mouth. So if they vomit, they're not going to aspirate it. They vomit out. Does that make sense? So let me demonstrate it on the other side. Thank you so much. If you lay back that way. So if I want to lay them on the opposite side, it's a similar thing. So what you're going to do is this arm, you pull it and put it on that side. The arm on the opposite side, you bring it and then support the mouth, right? and then you pull the leg on the opposite side that way. Once you've done this, you're almost done. So you just drop them towards you this way, and they will land in that position. Right? Thank you so much. Okay.
So that was the video on the recovery position. I've put the links in the chat earlier on. So if you want to watch that again, then you can go on YouTube and watch those. Do we have any final questions or comments before we finish? Okay. Thank you everyone for attending. Thank you for asking people to join us. We are done for today.